All right. Thank you, everybody, for joining. We'd like to go ahead and get started now, as we only have 30 minutes planned for this session, and we know how busy everybody is. So I'd like to take a moment and introduce our presenters today. We have Dr. Nicholas Lorenzo, who is our Chief Medical Officer here at MeMD and has been with us for the last 6.5 years. We also have Bill Goodwin, who's our Chief Executive Officer, and his background leading companies has proved to be crucial in building our own return to work strategy. And then lastly, myself, Allie Cassidy, who is the Senior Account Manager here at MeMD. I've been here for almost 7.5 years and handle our largest account. For today's agenda, we'll quickly discuss the COVID outlook in the coming months. We want to define what a return to work solution is and of course why it's important to have one. We'll also talk about how virtual care can enhance any return to work plan. We'll highlight some of the key features of our own COVID workplace solution, and then we'll wrap it up. So lots to cover in a short period of time, so let's go ahead and get started. So let's jump into this quickly with our first takeaway, which is the COVID-19 outlook. I'd like to ask Dr. Lorenzo, what are your thoughts on this?
Well, thank you very much for that introduction, Allie, and welcome to everybody who is on the webinar today. Thank you for your time. And let me just start off by saying that it might seem like we have been in this crisis for several years now, but we're going into our 6th month, but it's been a long 6 months for all of us. And some of you out there may have been tracking what are some of the advances in COVID-19, what's the outlook for the next several months, to the next year or so. And you probably have heard about some of the advancing therapeutics. I do expect there to be 1 to maybe 3 drugs introduced in the next 2 or 3 months that are specifically targeted toward COVID-19. So that's great news. And also with regard to a preventative vaccine. We are moving at warp speed toward a vaccine. I do expect personally that we will see an FDA-approved vaccine later this year or early next year. But even if we take the best case scenario with regard to all of that, and let's say we have a vaccine in November, December, January that's approved by the FDA, it's going to take several months to ramp up production and get it out to everybody, the millions of people who are going to want the vaccine. So really, we're not going to be able to get vaccines out to the people before late spring, probably early summer. So the bottom line is that COVID-19 is going to be an important part of the 2020-2021 cold and flu season. Typically that starts in October, late October, and lasts into April. And so we're going to have our typical cold and flu season plus COVID cases. And so employers have to be ready to deal with that situation, at least through this next cold and flu season, perhaps even longer. So although there is exciting news on the therapeutic end and the vaccine end, we're going to have to be still dealing with COVID-19 in a serious way for another 6 months at least, if not somewhat longer. And so it's important for employers to have a return to work strategy. So I'm going to turn it over to our CEO, Bill Goodwin, to discuss what that might entail.
Well, thank you, Dr. Lorenzo, and thank you everybody again for joining us today. You know, when you think of a return to work strategy, you have to look at it holistically. And when you start trying to do that, it can be a little bit daunting and a little bit overwhelming. There's quite a bit to it. How do you keep sick employees home? How do you make sure healthy employees are able to work safely? How do you meet compliance standards? And so really when you're crafting or looking at maybe rounding out your return to work strategy, there really are 7 key elements that have to fit in to that overall strategy. So if I can, let's start at the upper left in the light blue circle, and we'll work our way counterclockwise, is how do we keep sick employees from going to work? Well, to do that, you have to have the right testing to make sure you identify people who are sick, and also to make sure that you rule out people who do not have COVID so they can return to work. So, and then how do you make sure they stay home long enough to get the treatment and the time so that when they return, there isn't a reinfection. Additionally, how do you reopen workplaces safely and responsibly? I mean, when you think about reopening a workplace, it isn't just about opening the doors and having cleaning supplies. It's more about spacing and structure, and are we transparent with communication? How do we help employees know what to do and what not to do each day they're back in the office? When we look at the next one, physically distancing, well, distancing is beyond staggering shifts. It also includes, how do we make sure that we have breaks at different times? How do we make sure we set up, if we're in an office setting, how do we make sure we set up cubicles or offices with the right distance? How do we minimize contact within meetings? So physical distancing and looking at that for every possible interaction with the workplace is essential. Next, we look at non-essential people at home. Now, I know some of you are in businesses where that's just not possible, right? You have, everyone has to come into the office. It is that type of factory or production capability. But where possible, can non-essential people be home? In administrative capabilities, whether it's you're more in a workforce that can be distributed, do as much as possible of that over the coming months, especially as Dr. Lorenzo pointed out, we're not going to have a vaccine tomorrow. We'll start to have a vaccine sometime around the new year, and it will be months before everyone can get vaccinated. So the more you can keep that distancing occurring, the better. I mentioned this a little bit before about providing reinsurance. You know, your employees are your most critical asset. And if you can't provide the reassurance that A, you're opened up safely, but B, that you're communicating effectively, that you are doing the steps every day that you need to do, that you are getting their feedback on what you can do better. You have to provide that reassurance. Cleaning practices, and you'll see some of this, I'm sure some of you have seen this even in the OSHA standards, there are standards you have to meet in terms of cleanliness now at a higher level. If you have people in the office or in the factory, you have to make sure you're meeting those. And then one that I think is most critical for employers is you have to be able to demonstrate and actually do that you're meeting all the legal and compliance requirements. There's a big issue with, or could be an issue with employees looking at you and saying you didn't meet it, and you don't want to be in that type of legal predicament down the road. Now, as we look at the plan, so we know what the components are, but let's talk for a minute about the plan. There's 3 reasons that you need to have a plan in place. The first one is, as we mentioned briefly in the bullet, is to reopen and stay open. It's pretty easy to reopen, but how do you stay open? I'll give you an example. We work with a company that's a big food processor. They have multiple plants in a Midwest city. And early on in COVID, they had 5 cases out of 1,000 employees, and the health department shut them down for 5 days. The cost of that shutdown was $1 million per day to that company. You can't keep doing that. You can't sustain that. And I am sure with each of your businesses, the idea of closing down, sending people to be remote again, having to furlough people is not an option in the future. So your plan has to be there to help you be able to stay, not only reopen, but stay open. The next component is it's employee engagement and buy-in. We mentioned they are your most critical asset. I'm sure you feel the same way. If they don't think that you're taking every step or that you have a comprehensive plan that's transparent and they understand it and that you walk the talk, you're going to struggle with employee engagement. So to get that engagement high, they have to know you're doing everything possible and have the right plan. And the last component is a safety net. From a safety net standpoint, you can look at this from 2 vantage points. One is for employees. It's a safety net to make sure that they can keep working and keep paying their bills. And for employers, it's a safety net to help make sure that they can stay in business and be able to do it. Now, let's talk about a plan. No plan can actually cover 100% of the possible scenarios with COVID in this fall. But a good plan that incorporates those 7 elements we talked about earlier, and then you can check the box on these 3 things then you can feel pretty confident you're going to be 80, 85%, 90% covered for most scenarios that could play out. Now, with that in mind, I'm going to move on and I'm going to turn this over to Nick to talk about how do you build a complete and dynamic solution. Nick?
Yeah, thanks very much, Bill. And so now we're going to dig into some of the details as to how you can complete what Bill was talking about on a higher level. So let's talk about that a little bit. You know, we're going to have cold and flu season. You're going to have employees who report a sore throat or a fever or a dry cough. And in years past, it's like, oh, okay, we'll send you to a provider and get a note, we're all good. But now with COVID-19, it's much more complex. And so you have to be able to monitor your employees more closely, be able to test them. Do they or do they not have, in fact, have COVID-19? Get them evaluations, preferably virtual evaluations, if in fact they do. And be able to reassure your employees and yourselves that you're doing everything to get a sick employee well and also to protect the rest of your employees from potential infection. So how might that work? Let's talk about some specifics here. Probably the first thing you think of with COVID-19 is testing. We've heard over and over again over the last 6 months, testing, 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 and it is very, very important. And so if somebody does come up with a symptom that could be COVID, but could be something else, could be your run-of-the-mill cold, could be influenza, how do you tell the difference? Well, the MeMD Return to Work plan product does have a part or a component that allows for home saliva sample collection for the PCR test. So the PCR test is a test that can tell you within about 3 days whether or not that particular employee has COVID-19. And that collection kit can be sent to the employee's home, for example, while they're at home quarantining as per CDC criteria. The sample can be collected, a saliva sample, sent, shipped in the mail to the laboratory, and in about 3 days, you have the answer. Does that employee, in fact, have COVID-19 or not? And then within your employee group, the ability to screen for potential COVID symptoms is very, very important. So trying to find out as early as possible, does anybody have a fever? Does anybody have a sore throat or a dry cough, nausea, vomiting, loss of taste and smell? All of these symptoms that you've heard on the news in the last 6 months might be consistent with COVID-19. Identifying those employees quickly, getting them isolated, and getting them tested in a safe and efficient manner is a critical part of a robust return to work solution. Bill touched on the voluminous occupational health regulations and laws at the state and federal level, and even within your own HR department. Much of this can be handled by having a good paper trail. That is, that the employee patient understands where they are in the process, and you're keeping track of that process. And one of the more important parts of this are the medical excuse notes. In other words, if an employee needs to be sent to home isolation as per CDC criteria, they can be evaluated virtually by a provider, and a medical excuse note can be given to that employee patient, which then can be given to you. So everybody's in the loop, everybody knows what's happening, everybody knows that we're doing this as per the CDC guidance. And then as the patient begins to improve and recovers at home, they eventually will meet the criteria as per the CDC for release from home quarantine. And so getting that medical release note from the provider who confirms they have in fact met the CDC criteria for release from home quarantine reassures again the patient that they're okay, they can go back to work. It leaves a good paper trail for you to keep track of what's going on. And it also inspires confidence in the remaining employees that, in fact, a returning employee is good to go. They're healthy and they'll be able to contribute, and they're not going to potentially infect other employees. So the way that we are able to administer this type of program most efficiently is by virtual care. Back in March and April, when this crisis first started, the President, Department of HHS, the FDA, the CDC, and various state and federal government agencies all talked about virtual care playing a huge role in addressing the COVID-19 public health emergency. And in fact, it's turned out to be a resounding success. This can continue in a return to work program where the potentially sick employee with COVID-19 can be evaluated, monitored, treated, and tested at home, significantly decreasing the risk of transmission of COVID-19 to the rest of the workforce. And finally, one of the more under-discussed and under-addressed issues with COVID-19 are the stressors that are involved that could affect not just people who have a previous behavioral health diagnosis. So for example, employees who have a previous diagnosis of depression or anxiety or panic attacks. Of course, those can be exacerbated by the stressors of COVID-19, but also other employees who maybe never have had behavioral health issues. We're now 6 months into this process, looking at least 6 more months. The stress of not knowing whether you will have a job, the stress of trying to provide for your family, the stress of not knowing whether you could be infected at work. All of these types of issues can lead toward behavioral health diagnoses and conditions, and a robust return to work strategy. As per MeMD, we do have a telebehavioral health solution on the teletherapy side and the telepsychiatry side. So this is a robust and strong return to work strategy that can help both employers and their employees feel comfortable reopening their businesses, keeping them open in a safe and efficient manner. And so I'll turn it over to Allie now to give us more specifics on the MeMD Return to Work program.
Great, thanks, Dr. Lorenzo. So the third takeaway is start now. We are absolutely seeing the need for a program to be put in place right away, but you as the employer also have to be flexible as things are changing constantly, basically daily. So what you can do as an employer is try and prepare as much as possible. At the end of the day, what matters most is the health and safety of your employees, whether that be their mental health, their physical health, or financial health. Making sure that you have all this covered provides a productive environment for your employees. Thank you. So here in Arizona, businesses are starting to open. Certain groups, such as gyms, movie theaters, water parks, have to meet certain benchmarks for them to open safely. So what we know is COVID is not going away. So you want to plan now. Make sure that your plan has a virtual component to it. And last but certainly not least, don't wait to start. There's absolutely no reason you need to wait. And in fact, with our COVID service line, you don't have to wait for renewal. We can get this stood up in a very quick fashion. And frankly, this would stand separate from any other telehealth service that you already have. So I wanted to address a few questions that we got here in the chat. So the first one that I have is the CDC just released new testing guidelines. Do those impact any of the testing options that you offer? So Nick, I am going to turn that over to you.
Sure, thank you, Allie, for that very, very good question. And so one thing I will say is that MeMD, we keep very, very close tabs on the regulatory and legal status of telemedicine, telehealth services, including COVID-19. And the CDC has been putting forth updated guidance on a variety of issues, including testing. And some of you may have seen in the last couple of days a slight change to the testing in asymptomatic individuals with regard to COVID-19, that PCR test I talked about. And looking at that more closely, what this really does is it is somewhat of a change, but it's more of a nuance in that what the CDC is trying to do is give healthcare providers more control over the testing, especially of asymptomatic people who might have been exposed to COVID-19. So I want to make it clear, healthcare providers can always order a COVID-19 test after evaluating an individual, and this doesn't change with these new regulations. But rest assured that MeMD constantly keeps track of all this, and will keep it updated really up to pretty much every day.
And if I can just add on to Dr. Lorenzo's comments, I think it really comes down to what the employer is comfortable with. And, when someone has been exposed, the degree of exposure, how critical that person is to the operation. In many cases, I think some employers are going to want to test. And part of the reason to do that too is you may have somebody who is critical for work and you want to rule out that they don't have COVID so they can get back to work. So that's really now with the nuanced direction from the CDC, it gives the employer a little bit more discretion on it. But in general, I think it's smart to think about what is the best thing for the rest of the employee population, what's going to make them feel good. And two, how can you quickly rule out if it's COVID, or can you, if you can't test, can your business afford to isolate that person for 10 or 15 days after potential exposure?
Great, thank you. We also have a few questions about at-home testing, including the accuracy and timing. So how does that compare to a drive-through site? Dr. Lorenzo?
Sure. So the at-home saliva collection test kit that MeMD has available in this protocol uses the exact same PCR test that is used with nasal swabs or throat swabs that can be obtained in a pharmacy or at a drive-in testing facility or even at a bricks and mortar healthcare facility. So it's the exact same PCR test, same very, very high accuracy for diagnosis. The advantage, of course, of having a home collection of the saliva sample is that it's easy for the employee, comfortable. Also, it's more comfortable to obtain a saliva sample, basically spitting into a vial, than it is to have a swab stuck into your nose and perhaps even back into your throat. So as far as the comfort level is concerned, saliva collection is much more comfortable. And again, this sample and this test is the same test that is used for samples that are obtained any other way. The accuracy is the same, 98, 99% or higher, and you're going to know as an employer and the employee as well, do they in fact or do they not in fact have COVID-19?
Great, thank you. And then there also seems to be a little bit more interest on the release note. So maybe we should just spend another minute or so discussing how important those are for employers.
So I can start off on this one. What's so important about this is that within this program, there'll be control from the start of the home isolation as per the CDC guidance, and also the ending, the formal ending of that home isolation as per the release note. This is a unique type of product that MeMD has put together to make it easy to be compliant with any type of occupational health regulations or laws at the state or federal level. And it also breeds confidence in the employer and the employee that there is a very defined process in place. And also keep in mind that the employee is being evaluated both at the beginning and the end of this process, which again ties a nice bow to it all, that you have a complete program that can ensure that the employee coming back to the job site is healthy, ready to go, and will not, in fact, infect any other employees.
And maybe just to add on to Dr. Lorenzo's comments, it isn't a question of, if you will have, for most companies, if you will have a COVID outbreak, if you want to call it, you're going to have them. It's when, and it can be frequent over the next several months. So the documentation, having that documentation as an employer does a lot of things. In addition to giving reassurance to both the employer and the other employees, it will give the company reassurance that they've done everything possible to mitigate and prevent COVID and people getting affected. So the notes are almost more critical for the employer, if you want to say, than anything else, to keep them safe and compliant over what will be, I think, somewhat a unpredictable 4 to 6 months that we all have coming up in front of us.
Great. Well, thank you so much for answering the few questions that we had. So I'd like to take a moment to thank everybody for joining us today. Certainly appreciate you taking the time out of your busy day. We will be following up with an email that includes access to the slides. And if you have any questions, we would absolutely love to address those for you and learn about how you're handling your return to work plan. So thank you again, everybody, and have a wonderful day.